Good evening. My name is Angela, and I am presenting a case on a 48-year-old Caucasian female that I saw at the very beginning of my practicum. She is a 48-year-old Caucasian female. She presented with major depressive disorder and generalized anxiety, as well as PTSD. She's doing pretty well on her current regimen of medications. However, she's been feeling more anxiety because of her upcoming surgery. That's normal. So I chose to just leave everything as is. We kind of had a psychotherapy session with the CBT and talked about her surgery a little bit more. She is co parenting well with her child's father, and his step parents are all getting along. The patient's daughter has family based services, so they help actually with the entire family unit. This particular daughter was raped at a local movie theater recently and also has a history of abuse as a 13-year-old within her family. So there's a lot of trauma there. And her medications I just kept as is are the Victoza 1.8 milligram tablet daily, the Celebrex 200 milligram capsule twice a day, and her Duloxetine 60 milligram capsule daily. And then she has their albuterol for whenever she has her asthma flare-ups. Like I said, she reported higher levels of anxiety and stress. So we're just going to monitor this and see her back in 4 weeks. She does know to call sooner if she needs to. Patient usually drinks 1 to 2 alcoholic beverages weekly, but she hasn't because of her upcoming surgery on her hip. She has no known allergies. Reproductive review of systems was unremarkable. And her vital signs were within normal limits. Her mental status exam was unremarkable. She just has the anxiety and the flat affect, but everything else, she's oriented. She appears her stated age. Her thought process is organized. She has no plan or intent, no SI or HI, and her insight and judgment are pretty fair. The major depressive disorder I gave her because she does have mood swings, intense sadness, moving more slowly, just having more crying episodes. As the anxiety, she has the generalized anxiety because she feels overwhelmed and worries about all situations. Currently, it's her surgery, but that I consider normal, as most people would worry about that. And then, of course, with the sleeping and eating, she has some disturbances with the PTSD. She did have the trauma with her daughter being raped and sexually assaulted within her family. Her daughter does have flashbacks and nightmares as well as the patient. And there's many triggers there, such as the movie theater and whatnot. I feel like my preceptor did a pretty good job, and she's pretty compassionate and advocates for her patients and the therapeutic techniques in building an alliance and trust, especially with our psychiatric clients. For this case formulation and treatment plan, we did talk about the PTS triggers, strategies to help, avoid those triggers or how to deal with them when they come up. And the plan was for the patient to remain on her medications and reevaluate in 4 weeks, and to continue her daily medication of Victoza, Celebrex, and Duloxetine, taking the Celebrex twice a day, and to continue her appointments as well as CBT therapy to go together with the medications. And the patient does know that if she's experiencing increased anxiety or symptoms, and she can call the office. She has 911, go to the local emergency room, and also the crisis center is 24/7. And they agreed to that, signed the understanding for the treatment plan, and they were scheduled for a 4-week follow-up. And that is all I have on her. She's overall doing well and a pretty straightforward patient. Thank you and have a great night.